Thank you. Our next question is kind of about the clinical trials and future of CAR T. What is the future outlook for CAR T cell for AML?
Yeah, that's a great question. So AML refers to acute myeloid leukemia, and that's different from acute lymphoblastic leukemia. It's an acute leukemia, but the actual cancer cell is from a different type of blood cell. The challenge with AML is that myeloid blood cells are responsible for protecting us from bacterial infections. So for example, if we give a CAR T cell and just completely kill all of the healthy myeloid blood cells, guess what? Patients get really, really sick with infections. So that's what's made it a little trickier in developing a CAR T cell for AML, because you need to have the CAR T cell kill the cancer cells, but really preserve enough of the healthy blood cells to prevent these bacterial infections. So right now, there are clinical trials ongoing and developing CAR T cells. And some of these CAR T cells actually bind very specific targets on the AML and are engineered to secrete drugs. So it's kind of using a multi-step process. So I think the future of CAR T cells in AML are some of these novel, newer CAR T cell designs that I shared with you. For example, a CAR T cell that binds, but then also secretes a drug. I think that's where we're going to see CAR T cells that are being tested in AML.
Okay, thank you for that. I'm going to just take a brief moment. Dr. Johnson, your audio was a little funky. Can you just say if testing 1, 2, 3 real quick?
Testing 1, 2, 3.
It's like it's a little staticky. The audience can just be patient for a second here. We can try to get this remedied. You want to try it one more time?
Testing 1, 2, 3.
Perfect. All right. We're going on to the next question. No, that's good. Thank you. Will CAR T therapy induce injury to intestinal mucus layers and then lead to something like leaky gut?
So these are all great questions. There is a specific entity that's called an enterocolitis. And what that refers to is inflammation directly into the intestine. And that has been seen. It's been most commonly seen with BCMA-directed CAR T cells, which remember are the CAR T cells that target multiple myeloma. It's amongst those CAR T cells, it was most commonly seen with cilta-cel. In one study, it occurred in about a little more than 5%. So it's rare. And what happens in that scenario is that some of the CAR T cells go into the gut and they create inflammation right at that layer. And it tends to lead specifically to a diarrhea syndrome. So I would say, yes, it has been seen. It's usually particularly with a very specific CAR T cell, and it's rare, but we do see that. I think the main strategies to prevent that are what we talked about before, which is really trying to make sure that the cancer is well controlled at the time that the CAR T cells are given.